Hello friends, just a few days ago, a VIP walked into my clinic and says that he wanted a pill for his erectile dysfunction. And just as I was about to write a prescription out for him, he said, "Doc, don't give me the one that takes about 1.5 to 2 hours to start acting." Curious, I asked him why he should mention that. He says, "In my profession, I don't know when, where, and how my luck will open, and I can't wait for 1.5 hours for the action to begin. Something has to be quicker than that." That's one reason for not prescribing sildenafil. But there are many other occasions also where sildenafil, or as commonly it's known as Viagra, and its clones, the other PDE5 inhibitors as we call them, there are situations where these medicines do not work. For instance, a person may have side effects to these: headache, flushing, dyspepsia, nasal congestion, altered vision, pain in the bones. That occurs with Cialis most commonly, one of the brands of PDE5. With Viagra, there may be sometimes altered vision. These common side effects are so scary at times that one of the patients said that he never take this drug because of the complete loss of vision, and everything was blue in his vision. Very scary. So that's one thing that can prevent you from using PDE5 inhibitors, of which Viagra is one of them, and there are others also. Besides this, there are other situations where these medicines do not work. You see, it's very important that this drug is combined with lifestyle changes. There has to be foreplay if these medicines are to work, and that is patient education, which is lacking in most of our centers here. People pop this pill in and hope that it's going to work. No, there has to be foreplay before this medicine starts to work. Then there can be subnormal hormone levels. The male hormone testosterone is essential for the proper functioning of the penis, and this may be low due to many causes, but low levels of the hormone prevent these pills from working. You give them testosterone and suddenly everything starts to fall in place. There may be diseases affecting the feline vasculature, the blood vessels. They may be affected, as it occurs in diabetes, hypertension, high blood pressure, excessive fat, smoking. All these things can cause these pills not to work. So what does one do in a situation like this? Here are some of the things that can be done, like intracavernous injections for various drugs. Piperacillin is one that's very frequently used, and we mix it with some other drug to reduce the quantity of the medicine to be injected. Where is it injected? The upper surface of the penis has got two tubes into which the blood flows for it to become turgid. Now, when this blood flow is deficient, we can introduce certain chemicals which will make the blood vessels enlarge, and then blood flows more freely into the penis and gives a hard direction. However, this is by an injection that has to be given at the base of the penis. So what does one do when these pills don't work for whatever reason? Here are some of the things that can be done and have been tried, some successful, some not so successful, and some given up. Let's talk about intracavernous injection of various medicines. Piperacillin is one of that. You see, the upper surface of the penis, that part you can see, has two hollow tubes into which the blood flows, and that causes an erection. If for whatever reason the blood does not flow properly, then we get a situation like erectile dysfunction. Now, there are certain vasoactive substances, that is, ones that can dilate the blood vessel, and these are injected, guess where? Into the base of the penis. It's a very difficult thing to fathom, to realize that the injection has to be given to the base of the penis, and no doubt it's painful, but it works. The problem with these intracavernous injections is that they can be painful, they can be extravasation, and there can be corporeal fibrosis. Fibrosis means that the area becomes hard where the injections have been given. For these reasons, the dropout rate in my practice is very high, and I no longer use these injections. Nearly all patients drop out after 6 months. There is a Muse applicator that is also can be used in cases where sildenafil does not work. And this system has a device by which the pellet of the medicine can be injected to the mid-urethra. The pipe that leads the urine out into the mid part of that, this pellet is released, and then it works from there, it's absorbed and goes into the system to produce an erection. This is the Muse device. The problem with this is that it's unreliable, and you can be waiting for hours and nothing happens. I used to be in England long time back, and we used to use this Muse applicator very frequently. One fine morning, I got a patient coming to the clinic saying, Doc, don't give me that Muse system. I said, why? He said, I was having dinner with my neighbor, and then after dinner we got involved. I put the Muse system, but nothing happened till the morning, and my name is mud now. I can't face this neighbor. I have to leave the neighborhood. This happens in England. In India, it's even more problematic because the urethral infections are much more common in Asian part of the world, including India. And therefore, the absorption is even more irregular. So this also is not so good. We then have what is known as a vacuum device. Vacuum device consists of a hollow cylinder into which the penis is put in, and it is sealed by using a sealant silicone gel. There is an electrical connection which which introduces a vacuum around the penis in the tube. This pulls the blood into the penis, and when it is firm enough, a rubber ring is slipped onto the base of the penis, keep the blood inside the penis. Effective, but then, as you can imagine, it's cumbersome. And if you forget to take off the ring, as one of my patients did, then you will have a black and bruised and edematous penis by the morning. This patient wanted to have a second round, and therefore he left the ring constricting the base of the penis. But then he fell asleep, and in the morning, lo and behold, he had a problematic penis. I had to call the local carpenter to take out the cut through the ring. Then we have what is known as ED1000 machine. This is LISWT, low intensity shockwave therapy. It is of recent origin, and I've had this machine for almost 10 years now. One of the first ones in the world to procure it. But it's now coming to recognition. It's an outpatient procedure. What it is that there is a probe attached to the machine, which is put on the surface of the penis. The machine emits ultrasonic waves which set up an inflammation in the shaft of the penis, the muscles of the penis. It sets up an area of inflammation in that region. And wherever there is inflammation, wherever there is swelling, blood rushes in to correct that situation. And this is what we want. We want more blood to rush into the penis so that it will become hard. It can be done at suitable time to the patient. It's a outpatient procedure. And you know what? It's already being used for heart situations where there are blood vessel problems. The same principles are applied to the penis, and we are now using it more and more frequently. Let's talk about the surgical procedures for erectile dysfunction. There is venous leak surgery that can be done. You see, the nature is wonderful. The blood vessels in the center part lie the arterial vessels through which the blood flows into the penis, and the blood flows out through the peripheral or the outer side of the penis, where there are veins which take the blood away from the penis. Now, as the blood flows into the penis, it expands, and once it expands, it squeezes the veins which are situated on the outside. So blood goes in but can't come out. And this process maintains the erection till such time as the blood vessels start to, the inflow stops and the outflow starts. This is a balanced mechanism by nature. But problems can occur if these blood vessels which take the blood away from the penis have got valves in them to prevent the blood from regurgitating back into the penis. And if there is a defective valve situation, then the blood will flow in and just as well flow out. So to correct this situation, what is called as anatomical venous leak, if we take these veins out, the diseased veins out of the system through surgery, then the blood will stay in because the defective veins have been removed. There is still plenty of blood vessels which can take the blood away from the penis. It's simple and effective, and ever since we have started using penile Doppler study, we are able to identify sick cases and therefore improve the results. This fell into disrepute because it was done for all cases of venous leak, whereas many of them are physiological venous leak. That is, because there is less blood flow into the penis, these vessels do not work. Blood keeps on flowing out. When all else has failed, when the pills don't work, when the assisted techniques do not work, or it's cumbersome, we still have something of our armamentarium, which is the penile prosthesis. Nowadays, the penile prosthesis that we use are of two kinds, semi-rigid and the inflatable. Semi-rigid is comparable to a Maruti car, whereas three-piece is a Rolls-Royce. Both do a good job, but the comfort level is different. In the semi-rigid, the front part is stiff, the rear part is stiff, and in between there is the hinge, so that the penis can be placed inside the underwear. And when it is to be used, it is only to be angled towards the vagina, and man can start the process. No fiddling around with pumps or buttons. Sasta, tikau or bikau. The Rolls-Royce or the three-piece inflatable has liquid put into a reservoir which is placed inside the body. The rods are fitted like in any other situation, and they are connected to a bulb which is placed in the scrotum. So when you press the bulb, the saline or the water goes from the reservoir into these tubes very slowly, as if it is a natural erection. It's very close to a natural erection. There's a marked difference in the cost of the two implants. I put more of semi-rigid in than inflatable ones. What I mean to say is that many things can be done if sildenafil or the pills don't work. No need to worry. Go and see an andrologist, and he will guide you through the various. There are also a lot of nutraceuticals, herbal medicines that have come up. Some of them are very effective, but the problem is that no research has been done on these products. It's only experience that allows us to write the product. If you like the video, press the like icon. Any comments, please use the comment sections, and don't forget to subscribe to the channel so that I can bring in more videos for your benefit. It's nearing Independence Day. Take good care of yourself. Proud to be an Indian. Put up a flag on your building and enjoy the day. Jai Hind.